When do you know what's a pain worth worrying about and something you can just move through?
Well, for the most part, when someone's been doing something for a long time, they're an experienced runner, cyclist, triathlon, and they've been pain-free, and all of a sudden they start to be uncomfortable in the context of their normal workout routine, their normal competitions, change is a pretty good indication that something should be looked at.
But you must see a lot of athletes who push that off as long as they possibly can.
Yeah, and I think we often have this discussion about really being attentive to warning signs. So if the body's telling you something's different, if there's discomfort that comes with exertion and goes away with rest, that's really a good tip-off that talking to a doctor should be your first priority.
You're looking for patterns, really?
Yeah, so typically heart pain is reproducible and reliable, meaning it comes at the same effort day in, day out. So everyone's entitled to a bad day where they may have a sore muscle or a sore joint or something, but if you notice that you're having discomfort, pain, pressure, tightness in your chest at the same workload, meaning at the same speed running or at the same power biking or after going up the same amount of steps, and that happens routinely, that's typically a good warning sign.
You see athletes who are at the top of their game. These are not even, in some cases, weekend warriors, but these are people whose livelihoods are based around fitness. How shocked are most people who are physically fit when they find out they have a problem like this?
They're absolutely blown away. So the bottom line is that we know without question that exercise is the single best way to stay healthy and prevent heart disease. But no amount of fitness, no amount of dedication to an athletic lifestyle confers immunity. And when people develop heart disease that comes from an athletic background, they're shocked because how could this happen to me? I've done everything right. And the bottom line is, again, if you have risk factors, a family history of heart disease, high blood pressure, high cholesterol, they can catch up with you.
Can you improve your outcome because you've exercised?
Yes. So what you're doing is you're attenuating your genetics, meaning you're reducing the influence of genetics. So there's no question if someone has the genetics to develop heart disease and they exercise on top of that, they're either delaying or preventing. And certainly it can be prevented in some people, but without question, exercise is the best way to offset the genetic risk.
Do you see more of this now? Are people more aware of their genetic risk factors than they were, say, 10 years ago?
I think we're getting better. I think more doctors and more patients are comfortable understanding genetics as and we use the term genetics loosely, but a family history of premature heart disease as being a risk factor. And more athletes are realizing that, hey, if dad died at age 55 from a heart attack, perhaps that's an indication that I should be more concerned than my buddy whose dad lived until he was 90. So yeah, I think the awareness is really out there now, and that's a positive.
If you're concerned, should you avoid certain kinds of exercise? Should you have an appointment with your doctor before you start an exercise program? What do you recommend?
Well, a couple of things embedded in there. If you're already an avid exerciser and you start to notice symptoms that concern you for heart disease, strongly recommend people back off on their exercise until they can sit down with a doctor they trust and discuss it. If you're contemplating starting exercise brand new, there too is a good reason to have a discussion with a doctor beforehand, because based on either the presence or absence of risk factors, your doctor may either give you the green light or say we should do some testing before you get going.
How much of your role as a doctor is also, to some extent, about being a support to these athletes who are often used to sort of operating on a team with other really elite athletes, or as solo athletes where it's all on them?
Well, it's a great question, Lisa. I think I spend 50% of my time being a clinical cardiologist and 50% of my time being a psychologist, because the diagnosis of heart disease and the management of heart disease in people that don't feel like they're vulnerable to that is something that comes with a huge identity change. It comes with challenges that are above and beyond taking medications and getting procedures. It's a redefinition process. And I mean, I come from an athletic background. That's why I do what I do. So I get it. And part of the most rewarding part of my job is helping people through this process.
What do you say to them?
Well, first and foremost, you say that whatever happened in the past is going to be different in the future. And our goals are twofold. One is to treat your heart disease to the best of our ability, but to do so simultaneously with keeping you as active and fit as possible. So safety always comes first. Good conventional medication always comes first. Procedures come first, but a close second is optimizing how athletic and fit these people can continue to be despite their heart diagnosis.
Can you reverse heart disease?
That's a great question. You can certainly make improvements in the magnitude of heart disease. Some diseases, once you're diagnosed with them, are there for the rest of your life. But for example, coronary artery disease can, with the right interventions, the right type of exercise, the right type of diet, the right medications, be reduced. And so that's really our goal, is to move the needle in the right direction.